there we go. Portals of entry. Look, all you have, I listed, listed them for you right here, right? One thing that I honestly, I kind of failed to mention, blood, of course. But blood is kind of an interesting portal of entry because it has to be mediated by either syringe or a vector like an arthropod vector, right? Yes, it can be. It can be through the wound. Okay, absolutely. So broken skin, broken cover. Now, stages of infection. So adhesion. Understand the mechanisms that microbes use to increase the adhesion. So it's capsule, slime layer, fimbriae, and interaction with the specific receptors. Avoiding host defenses. So those three things, the exemplary things, because there's so many strategies, I want you to focus your attention at. Leukocytins, destruction of white blood cells, slime layer, so destruction of white blood cells, slime layer, phagocytosis, okay, and survival inside phagocytes, kind of self-explanatory. The disease. So understand the difference between the extracellular enzymes and toxins. So what's the difference? What enzymes do? For example, they break things, okay? It can be protease that will destroy the basal membrane, okay? It can be something else, coagulase that will coagulate the blood. Toxins, what they do? Huh? Not necessarily. They produce very specific response, often in a very specific tissue. Like they can block the receptor in nervous system, okay, causing paralysis. That make sense? That's specific. Or toxin of cholera toxin can block the channels, the chloride channels in the intestines, causing the diarrhea. So toxins have very specific response. Do toxins produce immune response? Yes. Can you inactivate the toxin? Yes, you can inactivate the toxin and use it to make a vaccine, right? As a component of vaccine. Can you give me an example of vaccine that employs that inactivated toxin? No. No. It's an antibacterial vaccine. It's a toxin, specifically toxin. That's viral. Okay, snake, although it's not infectious, that's an example of a toxin that that is used to produce antibodies, but that's not a vaccine, essentially. It's IgG. Tetanus. Tetanus toxin is used, okay, tetanus as vaccine example. No, when you get the shot, it gets stiff, the place of the shot, because just things injected. Types of infection. Systemic is obvious when you have a lot of organs involved, right, in tissues. Localized versus focal. Localized when it's a fuzzy separation. Localized is when it is restricted to, say, an organ. So hepatitis would be a localized infection. Okay, focal is when it's really, really small, like a wound infected with a microbe. Okay, carbuncle or furuncle will be a focal infection. Mixed infection, you have more than two pathogens, right? Primary infection, you have first, secondary, second. So obviously, example would be primary influenza, secondary, well, not flu. Secondary, let's say, streptococcus pneumonia. So streptococcal pneumonia, okay? Stages of infection, understand what you're going to observe. So I'm going to ask you, at this stage of infection, infected person does not manifest any signs or symptoms. What is going to be? Incubation, right? So understand that difference. Understand the difference between sign, symptom, and syndrome. So what's the sign? Not objective. Like if a person, you frequently, huh? Say again? Well, tummy ache is what? Sign or symptom? It's a symptom because I'm telling you that I have tummy ache. So sign would be a fever? Sign, it's, look, now, if I have like right hand paralysis, can you measure it? No, it's either paralysis or no paralysis. Sign is something objective, okay? And symptom is subjective. What's the syndrome? Altogether, that's a characteristic for a disease, for an infection, okay? Inflammation, well, okay, 5 signs and symptoms of inflammation. Fever, color, dolor, rubor, color, tumor, dolor, rubor, red, redness, color, calories, color, fever, tumor, swelling, and dolor, pain. The 5th is loss of function. Okay? Signs and symptoms of infection. For this, emia. Okay? What's the difference between bacteremia and septicemia? In bacteremia is in the blood too. It's emia, so it's in the blood. But what's the difference between bacteremia and septicemia? Bacteremia, fungemia, viremia. What does that mean? It's in the blood, period. Septicemia, it replicates in the blood. It's not just in the blood. It starts to accumulate in the blood. Okay, yes? Is that what people mean when they say that sepsis? It's sepsis, absolutely. I mean, you have bacteremia. I mentioned that. You're probably tired of that mentioning. But you have bacteremia twice a day when you brush your teeth. You have bacteremia when you have an open wound. Bacteria get in the blood. They're there. Trust me. But if they don't replicate, you're fine, okay? Exit portals, skin, aerosols, feces, okay? Urine, blood. Blood, again, requires vector or transmission by the, like, passive carrier, like person moves the syringe back and forth, right? Long-term infection. Understand the difference between latency, persistence, and chronic infection. Latency. No replication. What about signs and symptoms? No signs and symptoms. Persistence. Replication. No signs and symptoms. Chronic. Replication and signs and symptoms. What about sequelae? What about what it is? What is the sequelae? Consequence, right? A long-term consequence. Like when people get paralyzed as the result of polio infection. Okay? The transmission. Reservoir. What is reservoir? Microbe, right? Where microbe lives. Can reservoir be a host at the same time? Yes. Okay. Does that make sense? Now, living reservoirs. Can you give me an example? Okay. Yeah. People for measles, they reservoirs and hosts at the same time. Non-living reservoir. Non-living reservoir. Water, soil, right? Soil reservoirs. Carrier. When we talk about carrier, who we usually refer to? A person. Carrier is the person, okay? Asymptomatic person. Person in the incubation stage, convalescent, okay? Because, now look, why we don't say infectious carrier? So we say asymptomatic, incubation, or convalescent carrier. Why we don't talk about people who have active infection? Everybody knows that they're infected. People will stay away from them. Does that make sense? We just don't call them carrier. They're actually infected patients. I mean, they're not carriers anymore. They're sources of infection. Does that make sense? Is that confusing? Typhoid Mary would be a carrier. We're going to talk about Typhoid Mary, but you probably have heard the story. Okay? So Typhoid Mary, or those guys from Nepal that came to help after the earthquake in Haiti, they were carriers for cholera. They didn't have any symptoms. They brought cholera with them, and the outbreak killed thousands of people in Haiti. And you can't blame them. They had no idea that they have cholera in a. Okay, chronic. Obviously, somebody who has chronic infection, passive carrier. I take infected, like person used some medical utility and I carry it and use it with another patient. Okay, like this, like the urine thing, the collector for urine. Okay. Vector. Huh? Something that's not human that transmits infection, right? From one to another. Mostly arthropods. What's the difference between biological and mechanical carrier?
Biological or mechanical, they just like touch it and carry it, right?
Yeah. So what does not pathogen do? Doesn't?
Oh, it doesn't.
Replicate. It replicate. Don't be afraid to say things. Okay, it doesn't replicate. Does that make sense? Mechanical, no replication. Okay. And no, that's not a vector. Door handle, last time I checked, doesn't fly around the room. How do we call the door handle? Fomite. Okay. My colleague, Dr. Nussbaum, yesterday had a little bit of a respiratory infection, and he used the mic because his voice was almost gone. What will it be? The microphone, a fomite, right? All those things in a built-in environment. It specifically refers to built-in environment. When we say built-in environment, cabinets, table, cell phone, pen, all are fomites. Biological, obviously, replication. What's the zoonosis?
The ability for microbes to travel via animals.
What's the zoonosis?
It spreads from animals to humans.
Correct. It is normally an animal infection that spreads from animals to humans. And if you would survey the most severe infections that happen in the world, most of them will be zoonosis. How can we connect it to the microbe, to the properties of microbes that we talked about before? When microbe infects a new host. So look at this. You have a microbe. Yeah.
Well, it's not particularly advantageous for a microbe to kill itself.
Correct.
So when it suddenly spreads to a new host, it hasn't evolved enough to not just kill the new host yet.
Great. That's a great answer. You see? So when a microbe goes from animals to humans, in animals it doesn't cause such a severe disease because they co-evolved for a long time. When it goes to humans, there was no coevolution, and infection usually is much more severe. Take rabies, Ebola, tick-borne encephalitis, yellow fever, Zika virus. Okay, it's more severe. Does that make sense? Direct transmission. So what is direct transmission? Contact. What types of contact? Direct contact, do you know? Kissing. Huh? Sexual transmission. Bodily fluids like sweat, urine, feces. For some of the infections, it works. Okay. Respiratory droplets. Okay. In vertical transmission is considered to be direct. How can it be transmitted? There are two ways. Breast milk for HIV, yes, that's true, but transplacental, okay?